Joining me is Dr. Ayamo Oben, a maternal fetal medicine specialist with UT Health Houston and Memorial Hermann. Thank you for coming in, doctor.
Of course. Thank you for having me.
So the numbers show nearly 40% of black mothers experience these symptoms. When we talk about black women, maternal health more specifically, why is this such a big issue?
It's crazy that we're at that percentage, right? And it's such a big issue because I think of the number of barriers that we have in the U.S. There's issues with racism, systemic racism. There's issues with not having enough diverse providers and patients not seeing providers that look like them. And so those are some of the issues that come with just some of those things. And then finally, it's mental health, right? And as black people, we want to appear not crazy, and we want to, as black women, be the strong black women. And so the pressure to look like that prevents women from seeking the help that they need.
I know I've covered this topic in previous years, and I always hear where black women say sometimes in the delivery room, their concerns aren't often taken serious sometimes too.
Yeah, there's definitely history with that, with mistrust of the medical system. And so I think that has led to a lot of things in terms of postpartum disorders, right? Even postpartum post-traumatic stress disorder, because you have a life-threatening experience in the delivery room that then creates these mental health disorders that we see.
What are the warning signs that women and their loved ones should be watching out for?
I think if you see your loved one or women withdraw from things that they enjoy doing, really show no interest in the baby, they suddenly have random outbursts of anger, those are some of the signs that I would ensure that they look to seek for help.
So then when you get to that point and you have those symptoms, what should you do next and what help should you seek?
I think the first thing to always do is to call your OB provider, because believe it or not, most of them have been through that, whether it's through with their patients or personally. There's also lots of ways or lots of places where you can get those resources. The American College of Obstetrics and Gynecology is a good example, and there's lots of other good content out there, good information out there on where people can seek the help for mental health.
I've often heard that sometimes women opt for people like doulas and people that can speak for them in situations. Do you suggest that sometimes too?
I think it's important to have a care team, right? It's important to have a group of people because it takes a village to raise a child. It should take a village to have a child. And so because of that, I would say that having that support, whether it's a doula or whoever it might be, whoever you think will advocate for you is the most important thing.
Got it. Dr. Oben, thank you so much for coming in,
of course.
and hopefully people really keep this in mind and take those concerns serious too.
Thank you.
All right.